All right, welcome colleagues to the Global Coalition to Address Synthetic Drug Threats, Sub-Working Group 2.1. My name is Brian Morales, coming to you from Washington, D.C. at midnight, 6 a.m. Vienna time, and mid-morning to afternoon in the eastern part of the world. I have a few administrative announcements to get us started today, and then we will begin with our session. First, I want to provide some announcements, and I want to start off by going over the meeting schedule, the website, looking at initiatives and measures that we're adopting, and then finalizing the recommendations. We want to start off by thanking you for your valued partnership and participation over the past months. We are unfortunately seeing that the synthetic drug challenges around the world are worsening, particularly even during these months of the coalition. We have seen the continued emergence of new synthetic drugs and the rapid spread around the world. And we have seen, even just this past weekend, national emergency that was declared by the president of Sierra Leone over a synthetic drug called Kush, which is really spreading throughout that country. On the plus side, we have seen a lot of discussions, a mainstreaming of this discussion in many forums around the world, not least of which is the Commission on Narcotic Drugs that we are all very familiar with. At the CND this year in March of last month, we saw a lot of national statements on synthetic drugs and references to the Global Coalition. We also had and hosted 2 Global Coalition meetings, one a general catch-up for the participants and interested countries, and then we also had one for donor countries. And then we also saw many side events that took place around synthetic drugs, some hosted by governments, others by international organizations, and others still by civil society organizations. One of them, the Global Initiative for Transnational Organized Crime, had a very interesting map that I wanted to share, which is this one here, in a report that they issued, where they have found that from 2021 to 2023, you can see in the map, they're shaded red. Those are countries where the illicit synthetics markets increased in severity, and in orange countries where the market remains unchanged, just as bad as it was previously. And then in the green, you see decreases. So this is an issue that is bad and getting worse around the world. So what are we doing? We are focusing these months of April through July on action planning and implementation. And that doesn't mean that we only do it during our meetings, but also in between the meetings, we are now focused on this new phase of the work. You can see this is the meeting schedule from our website. What does action planning mean? What are we going to do during these monthly sessions, including the one today? Well, based on guidance from co-chairs in the monthly meetings, this phase will include sharing of national experiences. So if you all as national experts are interested to present on a topic, we invite you, we encourage you to present. Please follow the link in the chat that's pasted here. And please indicate what topic and what session you would like to present at. Then we will also have continued discussions on global initiatives of the coalition, like those that we have been reviewing in past months. And we will also be looking to engage other sectors. In the case of Working Group 1, maybe the private sector. In the case of Working Group 3, perhaps the civil society sector. Fourth, we're looking at also using these times to have workshops or training opportunities for coalition participants. But if what we find is that we run out of time or don't have enough time, we could always organize these workshops and training opportunities at other moments in the coalition's work. So not to fear if we run out of time. So let me get to a deeper explanation of what we're doing with recommendations and actions. Today, we are looking at the recommendations to finalize them. We have in total exactly 60 recommendations that have been developed through this process that we began in January of draft recommendations. We're going to finalize them today. And from there, we're going to be looking at actions that we can take in support of the recommendations. These actions or measures, you could say, are activities that we will be discussing, and we will be asking all of you participants to demonstrate your actions in support of the recommendations. So we'll be asking you to share that information with us. And you might ask, well, in detail, could you explain what is an action? What would you be looking for us to do as coalition participants? Well, one thing that you could do is to review the website where we have initiatives and to express interest in specific initiatives of international organizations. Currently, we have posted 115 initiatives across all of the sub-working groups that you can review, and you can indicate whether you are interested in participating in any of these. Second, you can provide bilateral or financial support to international organizations, or you can provide them with in-kind assistance to advance a synthetics topic. You may have specialized expertise. You can train, help other countries, mentor other officials in other countries that are interested in learning about a certain practice. Next, third, you could adopt a new practice, a policy, a regulation, or a law, and share that information with us so we can document that as a deliverable of the coalition. Fourth, you may want to engage and collaborate with the private sector, and for that matter, with other sectors like civil society. Fifth, you may want to host a regional or global meeting of the coalition on a thematic area of interest. Maybe a dialogue within your region with multiple countries, or a global meeting on a topic. Now, where do we go from here? These actions are being identified from now, beginning in April. We are going to initiate activities with international organizations from that menu of 115 between April and August. And by August, we will have achievements. And those achievements will help us develop a year one report that we hope to share with member states at the UN General Assembly in September. Then from October onwards, we will enter the full implementation phase, where each international organization will continue their initiatives. And we hope to then start looking at outcome measures by the time of the year two report in September of 2025. So where do you find these initiatives? Once again, on our website, globalcoalition.us, you will find the initiatives tab in the center page. When you click on that, you will see by sub-working group or a long list. Through a long list further down, you will see each of the initiatives listed one by one. You can click on the ones of interest. And when you open one, for example, this one is PICS, you'll see the background, the accomplishments, the project activities of what you would be doing, the outcomes that we would expect at a global and national level, and the countries participating. If your country is listed there, but you yourself are not participating, please still contact INCB in this case and ask to be added to the project, and they can get back to you with instructions. Now, some projects may involve more in-depth work and technical assistance, which might incur a cost, and international organizations may not have the resources to support all of the participants that have interest. So in this case, international donors, the United States and other countries will be working together to see if we can help generate additional resources for international organizations that are unable to meet the demand. So just by expressing interest, please do not anticipate that there will necessarily be resources, but we will certainly do our best to try to generate international support. Now, moving on to the last component before we get into the recommendations. We have a new website feature, and registration emails have been sent to all coalition members on a discussion board so that you can register to participate in the discussion board. If you have not received the email, please email us at syntheticdrugs@state.gov. What does this feature look like? Well, you'll see that there is a login button at the upper right-hand corner. Once you have registered, you will then have a username and password to log in. And when you log in, you will see at the upper right-hand corner that you have a profile that you can set up. And you also have a community section that you can click on. At the community section, you will see that you can put a banner. I put Washington, D.C., where I work. You can add your photograph if you'd like. And then you can have the sub-working group tiles for those sub-working groups that you are interested in receiving information on. For me, I joined all of them, but let's check out one. Let's look at sub-working group 2.2 on information sharing. When you click on your sub-working group, you will see a wall very similar to LinkedIn or Facebook, for example, and you will be able to add a comment and add images and make a post. When you make a post, I did one here, for example, on the public health emergency of Sierra Leone. I added a BBC news article and copied the picture from that article. And then you see that we have a comment. You can comment on that at the bottom. In this case, our friend Donald, from participant in the coalition from Sierra Leone, mentioned that President Bayo of Sierra Leone has declared a national health emergency, and they look forward to working with us. So we can have a free-flowing discussion. We can share more information. We can ask questions. I would encourage you all to look at this feature and to start using it as another way to communicate. And now I want to move on to the recommendations section. As the first item for today, we are going to finalize the recommendations and then post them on our website. And I am going to add this text to the website, but then also to any documents that are produced with the recommendations. I want to read the disclaimer or the chapeau, let's say, of the recommendations so that we are all clear. The recommendations herein are non-binding and for future government consideration where appropriate. They reflect the views of technical experts participating in the global coalition and do not reflect a consensus of governments or a single national position. I know that many of us participate in the CND and negotiate resolutions. This is not a national position. This is not a globally negotiated document by countries. We are technical experts made up of governments that are reflecting our technical advice, but countries are not expected to adopt any or all of the recommendations. You are free to adopt as many of the recommendations as you would like. This is sort of just guiding recommendations so that when we carry out our work, we can reflect on what the overarching goal is and what is recommended to support that. So in light of that, I would now like to move to 2.1. We have covered 1.1 and 1.2. So we have these recommendations. I would like to read them one by one, and then we will go into a discussion phase. So these are the recommendations for 2.1 with red and blue track changes based on edits that we have received since our last meeting in March. Recommendation number 12. Improve information on drug consumption, origin of substances, patterns of use and harm by developing and participating in a global forensic network to integrate regional networks, supporting the development of and participate in regional intelligence networks of forensic laboratories, epidemiologists, researchers, academics, law enforcement departments, and community stakeholders, NGOs, to improve data collection. At a national or regional level, supporting forensic analysis capacity with a focus on assisting those in low-income countries by providing forensic laboratory equipment, mentoring, guidance and methods, technical assistance, sharing reference standards, and supporting laboratory accreditation. 13. Facilitate and institutionalize sustainable and recurring non-personal data collection, analysis, and reporting systems through the establishment of national drug observatories and regional epidemiology networks with the purpose of strengthening early warning systems and international data collection and dissemination platforms. For example, regional epidemiology networks, ARQ, DMP, Drug Monitoring Platform, EWA, Tox Portal, etc. I continue. 14, to introduce and assess innovation of drug data collection techniques such as wastewater analysis, artificial intelligence data collection tools, rapid situational assessments, web-based clinical screening tools, biological samples from health facilities, access to data visualization through training and technical assistance to provide greater clarity and precision with respect to drug use and trafficking. Then we had 3 recommendations that were almost exactly the same verbatim to the previous ones that I just read. You'll notice it had the same ARQ, DMP, EWA. So we deleted those and integrated any additional text into the ones that I have just read to prevent duplication. Number 15, to create and strengthen early warning systems with new or reinforced work streams where appropriate to promote voluntary cooperation between forensic laboratories, national stakeholders, including the community, NGOs, health organizations, and researchers, academia, and to improve national, regional, and sub-regional collection and sharing of non-personal data to allow for real-time usage, including the development of mechanisms to alert emergency rooms and clinicians of new substances that are being detected through data from seizures and international early warning alerts in collaboration with emergency rooms and clinical treatment. And 16, share non-personal health data, including information on potential overdose spikes that could inform timely intervention prevention efforts. I believe we have one more. Oh no, I'm sorry. This is for 2.2. So this is the conclusion of the recommendations for 2.1. I'm going to stop sharing my screen at this time, and I'm going to ask if there are any edits to what I have presented thus far. If there are any comments, questions, or edits to what I have presented, I open the floor. And I invite you also, if you would like to provide any comments or edits, you can also do so in the chat. But if there are no comments or questions, then we will finalize this discussion and we will be posting these recommendations on our website. Okay. I hear no edits or comments. You can continue through the rest of the session I invite you to continue to post any questions, comments, edits to what I presented in the chat message. And otherwise, we will consider this conversation closed at the end of the meeting today. Now I would like to see if our co-chairs are on. I believe our co-chair, Hedy, was not able to join us today, but I do have the good news that I'd like to share with all of you, that we have a new co-chair for sub-working group 2.1. His name is Rakhmatullah Balashov. I see him on the screen. It's so nice to see you here. Thank you so much for joining us and for agreeing to co-chair our working group over the coming months. He serves as the counter-narcotics coordinator from the Academy of Law Enforcement Agencies, the Prosecutor General's Office from the Republic of Kazakhstan. We have a lot of leadership from Kazakhstan and so many of the sub-working groups, so we're very excited to have you join our group. I would like to turn it over to you to give an introduction of yourself, of your work, a couple minutes, and then we do have a presentation today from our colleague Jen Vermeulen from New Zealand. So I would also invite you to introduce and turn it over to her once you have finished your introduction. So please, Mr. Balashov, over to you. Thank you so much.
Hello, dear colleagues. Brian, thank you for introducing me. I'm very glad to be a part of this coalition. I also wanted to thank you and your team for your efforts. You are doing a great job. Thank you very much. My name is Rahmatullah Balashov. I am from Kazakhstan. I am a counter narcotics coordinator at the Law Enforcement Academy under the Prosecutor General's Office of the Republic of Kazakhstan. We are doing a lot of um, projects to counter the synthetic narcotics in Kazakhstan, and the last one is we are working on the creating targeting center and with INL in Kazakhstan. According to the agenda, the next presentation is scheduled now by Jan Vermeulen. He is a high alert supervisor and online channels manager of the National Drug Intelligence Bureau of New Zealand. He is now going to present New Zealand's drug early warning notification system for dangerous drugs, which call Drug Information and Alerts Alerter New Zealand, shortly it is DINES, operating publicly as High Alert. Please, Jen, the floor is yours.
Thank you so much, and thank you all of you for giving me this opportunity to present New Zealand's drug early warning system. So I've got a bit of a presentation for you. I will just share my screen. 1 second. Just a bit of background about me while I try to figure this out. I have been with the National Drug Intelligence Bureau for the last 4 years. Before that, I was in Prime Minister Jacinda Ardern's office as her social media manager. So been in the public service for a little while, and yeah, I'm excited to do this work. I don't know why I'm having trouble with this. Apologies. Nothing more annoying than watching someone struggle with technology.
Story of our lives, Jen. No worries. If you need to pull it up, I can. Let me see here.
It's just not coming up as an option for some reason. Ah, there it is. All good. Here we go. Got there in the end.
Yay.
Something doesn't work, just close it and try again, right?
Exactly.
Okay. Well, hopefully you can all see that now.
We're not seeing your presentation just yet.
Nothing? Okay, let's try again. Pilot, share. Nope.
There we go. If you could just click on the display settings and change it so we can see it in presenter mode.
Display settings.
In the top center.
Oh, yeah. Oh, no, didn't like that. Apologies, team.
No worries.
Oh, gosh. Try again.
Okay.
How's that?
Oh,
That's
great.
perfect.
Perfect. Apologies. I know it is late for some of you as well, so. Great. So just a brief overview. I will start by just explaining who we are, why we exist, and then how we do what we do, basically. So Drug Information and Alerts Aotearoa New Zealand, known as DIANS, is New Zealand's drug early warning system. And it is mandated by the National Drug Policy from 2015 to 2020. It is multi-organizational and multidisciplinary, so it brings together both government and non-government organizations to collaborate. So it is actually owned by the Ministry of Health, but it is housed within the National Drug Intelligence Bureau within police. So the purpose of it is to act as an early warning system in order to reduce acute drug harm in the country by identifying, one, where drug harm is occurring, by providing evidence and understanding of outbreaks of harm, and in some cases, anticipating potential for harm from drug-related use. So acute drug harm in this instance is defined as a sudden surge or increase of intense harm associated with drug use. The synthetic cannabinoid crisis that we experienced in New Zealand, which claimed the lives of more than 70 people, is an example of acute drug harm. And that is something that actually necessitated the need for this drug early warning system. So we launched publicly in June 2020 under the public brand of High Alert. So we have a website and an email subscription function so that people can directly subscribe to receive our alerts and our early warnings. Now, over the last 3 years, this has also expanded to include social media channels so that we can reach people where they are. Our main function is to issue those drug early warning alerts and notifications to our partners and to the public, but we also provide drug harm information through our social media channels and our website at different levels that I'll go through a little bit later in this presentation. So the public can sign up to receive these directly via email, or they can view them on the website. The website also allows members to report any unexpected or concerning effects from drugs they may have experienced, and this helps us get a better picture of people on the ground. Additionally, we offer the service for healthcare professionals that they can sign up through the website to receive any other trend reports or updates on information that we don't deem to be quite as valuable to the public, but could assist practitioners in reducing drug harm. Now, it is important to note that we are not actually an enforcement-focused organization. We are concerned with reducing drug-related harm, so any information that is provided to High Alert cannot be used for enforcement action. So we are a team of 4. There is myself, the online channels manager, and the supervisor now, and we've got a team of 3 analysts who do all the scanning and intelligence work for the system. So just going to take you through our information sources. The most critical role of our drug early warning system is our scanning. High Alert monitors a range of information sources to identify harm that has occurred or where harm could occur. Our understanding of the drug environment is based on the collective input of information sources. So each source provides its own piece of the puzzle, although some would be considered more valuable than others. So the frequency in which we monitor these sources varies. Some of them are monitored daily, whereas others are far less frequent and provide a more longer trend view rather than day-to-day actionable insights. Now, our sources range from proactive to reactive, or what we refer to as border to the grave. But as an early warning system, we really want to be operating in that proactive space to prevent harm from occurring. We have good coverage of the drug market through our sources, but there are a few gaps that we're still looking to address to improve our ability to monitor harm. Because we are quite a small country, we've got a population of 5 million, and we are a connected country in a way, so we don't have to deal with states or different providers providing healthcare or policing. It does provide us with a really nice holistic national view. There are various strengths and limitations to these data sources as well, but the risks that we are looking to address include particularly potent drugs, drugs that are being misrepresented as other substances, and the adulteration of drugs or any new drugs that are coming to the country for the first time. But just to give you some idea of how we use these information sources, so for the police records, for example, what we're looking at daily is police jobs related to a keyword search. So these include all live events entered from emergency and non-emergency calls made to police, reports entered by police officers attending these events, and reports from events that are not originating through the members of the public. We also look at all sudden deaths reported to police, which are reviewed to identify instances of acute drug overdoses. We review custom seizure data for controlled substances seized at the border for the months prior. And we also review drug-related ambulance calls for service related to a key set of terms. That's another daily one we look at. So we receive that data overnight, and the analysts will look at that and see if there is anything worth actioning. We also receive data from our drug checking clinics. Now, drug checking is free, legal, and confidential in New Zealand, and it has been legal for about 2 years now. So we get all the data from our drug checkers across the country so that we can see what they're seeing on the ground as well. We also monitor online sources like the dark web marketplaces and ClearNet and NPS vending websites. And we also have longer term trends like hospitalization data and wastewater data, which represent a conservative estimate of the nation's consumption of illicit substances. So this network of partners is really the strength of our early warning system. Before we existed, there was no coordination or the ability to bring together all these groups to understand what they were seeing on the front lines. There were previously no structures in place to allow harm occurring in one part of the country to be connected to harm occurring somewhere else. Now that High Alert are tapped into this network and can scan every day, we have a way more concise overview of these occurrences. So what do we do with this information? Should something of concern be identified during that scanning process, our analysts will start to investigate. So they will engage with relevant parties to seek further information and context. We often have questions around what a drug was, what was it sold as, what was it presumed to be, how prevalent is that particular substance, and did people experience similar reactions? Is it anecdotal? How much do we know? At this stage, we're really just trying to build a picture and gather as much information as possible to inform our analysis. Now, ideally, when a harm event occurs, a sample of the drug itself or a blood sample from the victim will be sent to the lab for analysis. This will often involve our analysts engaging with police or emergency departments to arrange for samples to be delivered to the lab. Now, when we talk about the lab, we work really closely with the Institute of Environmental Science and Research, or ESR, which is the New Zealand government research agency that provides drug chemistry and toxicology results. So lab analysis is the gold standard for a high alert and our notifications. The scientific rigor it gives our notifications allows us to have credibility. So it's not just a gut feeling. And it also allows us to provide detailed harm reduction advice that people can take actionable steps on. However, it's not always necessary to have lab results before we issue a notification, and that's why we have the risk matrix, which is on screen now. So once we've developed an understanding of the issue, the standardized risk assessment is used by the analyst to assess the risks of community harm. The matrix for each scenario is run through, generates a score that informs the analyst what to do next. And we really look at prevalence and harm, and then determine what the correct response is to that event. So this could be a harm reduction article, it could be a notification or an alert. The only real difference between alerts and notifications is the scale of the issue and how much how seriously we want people to take it. So alerts are really reserved for really serious kind of imminent death situations, and their notifications are things that could cause and lead to further harm. So when information is identified that might indicate a risk of harm to the wider community and it meets a certain threshold, we issue one of these. Now, since we've launched in June 2020, we have issued 26 notifications and alerts, and these have been nationwide and covered various substances, including 8 on synthetic cannabinoids, 6 on synthetic cathinoids, 6 on opioids, 2 on benzodiazepines, and then other substances as well. Now, how do we get these out to the public? So as I mentioned earlier, we have a website, but the effectiveness of the early warning system is significantly impacted by our ability to actually get this harm reduction information in front of the people who need it. While our message is very clear, that it's always safest not to use drugs, we know we have a responsibility to ensure that we take steps to minimize the harm caused by drug use wherever we can, while also investigating in the promotion of health and well-being to reduce drug use. So the key focus for the first years of our existence has been building brand awareness and trust in High Alert and the information we provide, so that when we do issue a notifications, we know that the public will take it seriously and actually take action. So we also have, we launched a Facebook and Instagram and a TikTok as we realized more and more people just get their information from social media, but we're always pushing people to sign up via email, because then we don't have to rely on an algorithm or news media to get that message in front of people when they need it. How effective is this? So while our brand building work is still ongoing, it is incredibly encouraging for us to see really clear engagement with our content. We've had over 1 million visits to the website, and we've built an email list of almost 10,000 members of the New Zealand public and almost 1,000 healthcare professionals, which allows us directly to reach people when we need it most. We consistently achieve a really high email open rate as well. The industry average is about 34%, but we average 64%. So through our social media activity, we've also reached over 2.2 million New Zealanders, predominantly on Instagram and Facebook, and on TikTok, we have had over 1.5 million views. Now, I appreciate for some of you from bigger countries, that doesn't sound like a lot, but we only have 5 million people in this country. So this is a marked shift for us in how we engage on this topic. The level of engagement also really seems to indicate that people need this information and they want to engage with this information. And it really supports the enormous potential of a drug early warning system like this to prevent harm. I thought I would take you through some case studies so you can see how this happens, how this works in practice. So in this case, in June 2022, 12 people in the Wairarapa region, just outside of Wellington, required urgent medical care, including hospitalization after consuming what they believed to be cocaine. So we became aware of this via our connection with the hospitals and started investigating. We managed to obtain a sample from one of the people and we sent it off to ESR to be analyzed, and they detected that the powder contained fentanyl as well as a sugar type substance. We have never really encountered this before in New Zealand, so we issued a public notification in the first instance while we were still waiting for those results from ESR, because we knew the cocaine had been misrepresented. We weren't 100% sure that it was fentanyl at that stage, but we didn't want to wait. So we issued that notification on 25 June, got the analysis the next day, and then updated this notification to a public alert on the 26th. So this was the first time we had ever issued an alert. Through this activity, we reached 65,000 people through our online activity, but there was significant media coverage as well. We had exclusives on the 6 p.m. news. It was concurrently released on Stuff, which is New Zealand's biggest website, where it was the best performing story. And over the following days, it generated a number of follow-up stories as well, because obviously people are very concerned about fentanyl. And all of this helped ensure that we amplified our harm reduction messaging. Now, it's really hard to assess the effectiveness of a proactive harm reduction strategy, because if nobody gets hurt, that means that you're doing your job, but you can't really prove that. So one of the ways we assess the effectiveness of our notifications is whether the harm continues after we issued the notification. Now, in this case, there was another incident a week later, but they were actually related to the group that was initially sent to hospital. They were all one group. So this was someone who knew what they had and chose to use it anyway. But there were no other further cases of harm identified, which we count as a success, because if we hadn't issued this, who knows how much harm would have occurred. So we continue to work with our network partners to mitigate the risk of further harm and provide harm reduction resources to the community post-notification. So in this instance, our drug checking providers stood up clinics in the Wairarapa region to get white powders tested rather. We didn't see any further occurrences of this. Now, contrary to what is typically reported in the media, fentanyl misuse in New Zealand continues to be assessed as low. It remains unlikely that New Zealand will encounter the level of widespread fentanyl misuse that we have seen internationally. However, we appreciate that this is always possible, and we rely on the ability of High Alert to provide early warning, because it's hugely important to save lives in the community as well. Now, if we are to see an increase in synthetic opioids in New Zealand, this will be one of the ways, through pressed tablets containing nitazines. Now, as you know, nitazines are potent synthetic opioids, often more potent than fentanyl, and these tablets are often sold at low cost compared to other illicit opioids, and it's possible that these tablets are perceived as more appealing than IV drug use and may attract people who would otherwise not consume opioids. Now, we have issued 4 notifications over the last couple of years regarding pressed tablets containing nitazines, including this one. So in March 2022, drug checkers Know Your Stuff found a potent synthetic opioid in a fake blue oxycodone tablet purchased in the Wellington region. In this case, it was a misrepresentation of a legitimate tablet, which are not prescribed in New Zealand. So ESR confirmed that the tablets actually contained a nitazine, which we know acts quickly to produce strong sedative or depressant effects. So we also knew that this substance had been linked to a number of drug deaths in North America and the UK, and that these tablets had been offered for sale on social media and widely available within the Wellington region. So with all of that, knowing all of that, we issued this notification. In terms of timeline, notifications can take weeks to issue if it's a slow burning issue and we're not 100% sure what's going on, but in most cases, it's a matter of hours. So this one, I think we found out about it at 10 o'clock in the morning. We had issued the notification by 2 p.m. that afternoon. The primary risk here is overdose, so we wanted to act quickly. But it's an interesting case study as well, because it shows the effect that these notifications have in the public sphere. We often see really positive engagement from the public following a notification. But also notably with dealers, on more than one occasion, dark web listings have been altered to actually reflect the harm reduction advice that we have included in a notification. And on one occasion, a seller actually removed the listing because they stated they had not realized that it had been misrepresented. So that's sort of an unintended consequence of the drug early warning system, where we're trying to keep the public safe, but it has this wider impact that we maybe had not anticipated. I wanted to raise this case study as well because it's related to a synthetic cathinone, but it's interesting as an example to see the real-time life cycle of novel psychoactive substances. So in July 2021, China banned Eutalone, which at the time was the most prevalent cathinone in New Zealand. So following this ban, we saw an almost instantaneous decline in Eutalone detections at the border. For the next couple of months, we were in a holding pattern, waiting to see what the next big cathinone would be. And then in December 2021, the synthetic cathinone dimethylpentalone was found in 2 samples being tested by Know Your Stuff in Dunedin. They were being misrepresented as MDMA, and this was the first identification of it in New Zealand. Very little was known about this substance. There were only a handful of published detections internationally, and so we didn't know the harm profile or the dosage, effects, or any real health implications. So the primary risk of synthetic cathinones is obviously misrepresentation. If someone is taking it thinking they're taking MDMA, they're basing their dosage and other decisions on their knowledge of MDMA instead of the substance it actually is. So the distribution of this substance was concerning at the time as well, because there were a large number of events planned in the future, including summer music festivals. And that usually results in a high consumption of MDMA. So because there was this risk of unintentional consumption, we put out the notification. So from about February 2022, we continue to see more and more of this, not only at drug checking, but also at the border. And since June 2022, it has been the most prevalent cathinone detected at the border, although that has started to decline. Along with Utalone, it is now the most prevalent cathinone in New Zealand, being misrepresented as MDMA. So those are our notifications, but we do also have other outputs to get harm reduction advice in front of people. As I mentioned, we have articles which contain advice and harm reduction tips. And we also address things that maybe don't meet a notification standard. So if there is harm associated with the substance that isn't necessarily outside of the expected harm. So for example, we've seen an increase of harm related to GBL use, particularly in the Auckland region, and we're going to put out an article to provide advice for people if they choose to use GBL or sub-G substances. So notifications are our key output, but we want to reserve them for the most urgent messaging because we need people to take action as soon as we put them out. Our social media use is much more broader as well, and then we have outputs that are specifically for our professional network of practitioners. So trend reports, which include things that we're noticing that we want people to feedback on. For example, we saw 6 new synthetic cathinones detected during the summer period. So that isn't necessarily a notification, but we want to know more about it. We also do specific reports. For example, we partnered with a music festival in Christchurch last year to produce a Safer Festivals report, looking at how people use drugs in the festival environment and what steps they can take to make that safer. And then we also provide presentations and briefings. Yeah, that's basically us, and I'm very happy to take any questions.